There are many things that shape us into who we are. Kids living in out-of-home care can feel lost in the world because they don't get the information most people do from their birth families. Contact with a child's birth family can help them better understand who they are and how they fit into their community. It can also help pave the way for a child's return to their birth family. So what is contact? Contact refers to any direct or indirect communication between a child in out-of-home care and his or her birth family and significant others. This can include parents, grandparents, siblings, extended family members, and previous foster carers. People who can safely give the child a sense of belonging, identity, and self-worth. It's important that contact with the child's birth family is safe. Decisions about contact are always made with the best interest of the child in mind. What does contact involve? Contact can mean face-to-face meetings or, if safety is a concern, children can attend these meetings with supervision from a foster carer, grandparent or caseworker. Contact also includes exchanging letters, cards, emails, phone conversations and exchanging photos and video footage. Decisions about contact are made by the child's agency caseworker or the Department of Family and Community Services as part of the case planning process. Decisions can also be made by children's court order. Some questions that need discussion include: what is the purpose of contact? Who should the child have contact with? Where should the contact take place? Caseworkers consult carers about contact arrangements, and you may be required to play an active role. Sometimes it can be hard to understand the importance of contact, but it is beneficial in most cases, and children in out-of-home care tell us they really enjoy visiting family and keeping in touch with their relatives. These are some quotes from young people. Susan, 10 years. All siblings should be able to contact each other unless there is a strong reason not to. I have brothers in care I have never seen or met. David, 14 years. I have a special meeting coming up where I will be able to ask questions about Mum and Dad. I know a bit. My aunt and my new caseworker will be there. I want to go to ask questions and find stuff out. Michelle, 18 years. When I was returning to my family, it helped just having some weekend stays so I could get used to being there again. My foster carer helped me with that. Amanda, 17 years. I feel really upset when I can't see my younger sister. She's still in foster care, but I live in residential care. Alex, 19 years. When I was in care, I found my caseworker and carer wouldn't help me see my mum because she lived so far away. I could call her, but if I wanted to see her, I kind of had to make it happen. That was hard. Contact is important for the child in care, but it's also important for birth parents, siblings and carers. For birth parents, contact provides reassurance that their children are safe and well looked after, but sometimes they can find this hard to express. Seeing their children also helps birth parents work through feelings of grief and loss. Together with support from appropriate services, contact visits can allow parents to develop parenting skills which can pave the way for the child's return to their birth family. Sometimes, carers find that when a child has regular contact with their birth family, they're better able to express their feelings. Contact gives the child a more realistic view of their birth family, so they're less likely to compare their foster carers with their birth parents. So what's the contact planning process? The caseworker from the child's agency or Family and Community Services considers everyone involved in the child's life before a decision about contact is made. The caseworker will ask: is restoration being considered? Have safety issues been considered? What is the child's age and developmental stage? What are the wishes of the child? Will contact disrupt the child's routine? How will contact be managed and supported? What is the relationship between child and parent like? Does the child have siblings living with the birth family or in out-of-home care? Are there any logistical, health or travel challenges? When a decision about contact is reached, the caseworker will record the planned arrangement in the child's case plan. These arrangements aren't set in stone. They should be reviewed to ensure they continue to meet the child's needs, and the case plan should be updated any time changes are made to contact arrangements. Contact can be nerve-wracking for children at first, but carers can help. You can help the child become accustomed to contact by discussing the upcoming visit positively. Try to keep an open mind about the child's birth family and try not to verbalise judgments about them in front of the child. When helping the child pack a bag for their visit, you could provide meaningful items to take to their family home. Think about objects that will help to generate conversation, like a school report card, photo, award, or something the child's made. You could also help the child become involved in family celebrations by making birthday cards and gifts. When a child returns from contact, comfort, reassure and talk with him or her, but don't pressure them for information about their family or their visit. Sometimes contact with birth families can feel unsafe. If there is any danger, it is always best to immediately call the police and then the child's caseworker. When safe, contact with the child's family is a positive experience for both the child and the birth family. Carers have said that while contact can be difficult at first, talking to other carers about how to make the child most comfortable can help ease the transition. Some quotes from some carers. Michelle, Aboriginal carer. I try to make visits with Mum feel as normal as possible. This makes the kids feel normal and relaxed, not another reason they can feel different to their mates at school. Esther, carer of teenager. Make sure you know if you need to send clothes or food for overnight stays and be positive when the child returns home. Jill, experienced long-term carer. Ensure the child meets the contact worker first. Also, continuity of contact worker is important. Sue, carer of 8-year-old boy. I found meltdowns after contact stopped when I asked my little one, "What special dinner would you like me to have ready for you when you get home?" Maybe that special dinner gave my little person something to think about on the way home. Marina, carer of 2 boys. I always send some photos, books, flowers from the garden, cupcakes, anything to act as a talking point with the child's birth family. Joan, long-term carer. Take along a camera or provide one to the contact worker so some photos can be taken of the child with their family. Then the child can make a collage for the next visit. Contact can require the cooperation of children, their birth families, carers and caseworkers. Finding the right balance isn't always easy and doesn't always go perfectly the first time. But seeing children and young people connect with their birth families and develop a sense of belonging makes it worth it. If you have questions about contact or if you require support with caring for a child, call Connecting Carers New South Wales. Our 24-hour hotline is staffed by experienced out-of-home care professionals who are always available to answer your questions and offer support. Call 1300 794 653. 1300 794 653.